Hi, I'm Dr. Naresh Bhatt from Aster CMI Bangalore, and this is my colleague, Dr. Viri, and we work together as a team. Kyle, IBD, big problem in India?
Definitely yes. 20, 30 years ago, we didn't have IBD in India, but we've been gradually seeing an increase, and over the last decade, we have had an increase in the number of patients with IBD. And in the next 1 or 2 decades, we probably will have the maximum number of IBD cases in the world. So we are definitely rising with IBD.
They keep talking about diet being a very strong driver for IBD. Of course, we know the genetic factors are there. What in the diet strikes you as being the big player in driving IBD?
I think it's like what I discussed earlier. 20, 30 years ago, we didn't have IBD in the country. Why are we having it now? I think one major factor is the influx of processed foods, or if I can use the broad term, westernization of our diet. I think that is where what the processed food, the packed foods, they are the important ones that are driving to us towards IBD.
Yeah, this business of westernized, I have a little problem with that. I mean, westernized people think that just because you eat some pizzas and pastas, that becomes westernized. No, I think the whole trend is that we are moving away from home-based food.
Absolutely.
Earlier, your grandmother cooked food at home, and we had food 7 days a week, 52 weeks a year. We hardly ate out. And though even if we ate out, it was maybe when you went out for a wedding or something else. But now, I think it's more that you eat out more often than anyone cooks a meal. I think that's the biggest problem. Of course, you're right.
So, and in the process, you're buying packaged foods to supplement that. And that is possibly enhancing the frequency of IBD in the country.
What do you think about the excessive use of, the aerated drinks, the fruit juices in the Tetra Packs that are available, the ice creams and the smoothies and things like that we buy commercially? Are there problems?
Yes, because if you try and make an ice cream at home, it won't have that creamy, nice texture which you get from an ice cream shop, because there are a lot of additives that go on to give that taste, that texture, and all those additives and the color. And all those additives are all irritant to the intestine, and they promote inflammation and hence increase IBD. So all these factors also contribute. So food additives is something that we need to exercise caution.
So as Kyle rightly said, is the ultra processed foods, the packed foods and additives, and the amount of meat that we're tending to eat, especially red meat.
Red meat.
Yes, as compared to that, fish and those things are much better.
Chicken, egg, the lean meats are fine. The red meats again are pro-inflammatory.
And of course, as they say, it's good to have a lot of color on your plate, a lot of vegetables with all the colorful vegetables, your carrots and potatoes and the greens and the legumes are all good for us. And I think that's where we need to go to sort of cut down this whole dietary driving force of IBD. I think that's the only time that we're going to cut down the numbers, which are otherwise going to be a huge burden for the healthcare in India.
Dr. Naresh, we are aware, yes, diet is, apart from genetics, diet is one important factor. But do you think the drugs that we prescribe often as doctors, are we at any way promoting IBD?
Oh yes. But remember that the biggest thing is in children. Infants, a lot of antibiotic use in children is a very, very important factor. The other thing is, of course, breastfeeding. A lot of women are not breastfeeding the children, and a good way to prevent IBD, or at least delaying IBD, is to breastfeed at least for a year. So breastfeeding and avoiding antibiotics as much as possible, especially in infancy, would go a long way.
Yes, that is another important concept. So we know genetic factors, environmental factors, our diet, drugs, all these promote. But what causes IBD is possibly a conglomeration of all this, and there is no single cause of IBD. If we knew that like an infection, it would probably be easier to treat. And fortunately, this is an autoimmune disease.
I'm going to ask you one question. Now, we have so many drugs available for IBD. I mean, why should a patient be still scared of IBD? I mean, there are drugs available. There's a problem, let's fix it. So what's your take on it?
It is not a one-time solution. It is a long-term goal. In IBD, we don't talk of saying curing the disease. We say controlling the disease. To make it simple, it is like diabetes. You don't cure diabetes. You control the diabetes, keep the sugars under control. Similarly, in IBD, you give the medications to keep the disease under control. IBD is a disease which has flares and remissions, ups and downs. The goal of giving the medicines is to increase the downs and decrease the ups. That is what we're trying to do. So it's a long-term treatment despite the availability of many medications.
So I think to just summarize, I think it would be fair to say one is try and prevent or delay it as far as possible with all your dietary interventions. If you have IBD, get it diagnosed early and seek good help to keep the disease under control. Ensure that once the disease is under control, then the chance of getting into complications, other risks are much, much less, and the quality of life is overall good.
Yes.
Is that okay?
Yes, absolutely, absolutely, yes.
Okay. Thank you.
Thank you so much.